everyone, happy May. As many of you may know, May is Ehlers-Danlos Awareness Month. I personally believe that one of the most important aspects of awareness is education. But in order to properly educate others, we really have to be well informed ourselves. When I was first diagnosed, I wanted to learn as much as I possibly could about my condition, so I joined a lot of support groups. And I have to say, I was a little bit overwhelmed. It was like these people were speaking a whole different language that I had never heard before. So in the name of education, I thought that I would take the time to try to clear up some of the confusing buzzwords and abbreviations that you often see associated with Ehlers-Danlos syndrome. You may have heard some EDS patients calling themselves zebras, or maybe you saw them using the hashtag #ZebraStrong. Or maybe you noticed that literally everything is plastered in zebra print. But where does this all come from? A famous doctor back in the 1940s once said, "When you hear hoofbeats, think of horses, not zebras." This mantra is commonly taught to medical students to remind them that when they see a patient complaining of symptoms, to always think of the most common cause of those symptoms and not the rare ones. But EDS patients have taken this and embraced their rarity. I just wish I liked zebra print a little more. And the second one is the spoon theory. You may hear the words spoons or spoonie thrown around a lot. And if you're not in the know, you're probably pretty confused. These phrases come from a story written by a chronic illness patient called the spoon theory. Basically, the writer used nearby spoons in a restaurant to illustrate to a friend how people with chronic illnesses or chronic pain have to ration out their energy throughout the day. I'm going to link the full story below in case you're interested in learning more. So if you hear someone say that they're all out of spoons, really they mean they have spent all of their energy for the day. Another word you might hear people calling themselves is a tubie. This one might be pretty easy to figure out, but a tubie is just a really cute name for someone who has a feeding and or drainage tube placed in their stomach and or their intestines. Subluxation. This is going to be a pretty common one to see. I think everyone's heard of a dislocation, but what is a subluxation? A subluxation is just an incomplete or partial dislocation of a joint. These are very common occurrences in the EDS population, and oftentimes we might not even know we're doing it. Okay, now let's move on to abbreviations. These first 5 are pretty easy. DX and RX. DX stands for diagnosis and RX stands for prescription. Then we have NS, RUMI, and PCP. NS stands for neurosurgeon, RUMI is rheumatologist, and PCP is your primary care physician. Next, you may see people writing HEDS or VEDS. HEDS and VEDS are just easier ways to write out hypermobility EDS and vascular EDS. And now the rest of these are just abbreviations for common conditions seen with EDS. I'm going to get into them a little bit, but I'm not really going to explain them fully. Hopefully in future videos I can get into each one a bit more. And the first is GP. GP stands for gastroparesis. Gastroparesis just means that your stomach is partially paralyzed and that causes delayed stomach emptying. MCAS or MCAD. MCAS stands for mast cell activation syndrome and MCAD stands for mast cell activation disorder. They're both names for the same symptom. Mast cell is an immune condition that causes cells in your body called mast cells to be too easily activated and release chemicals into your body, causing you to have an allergic or allergic-like reaction. CM. CM stands for Chiari malformation. A Chiari malformation is when your cerebellum, the back of your brain, is herniated and pulled down into your spinal column. CSF. CSF stands for cerebral spinal fluid. This is the fluid that surrounds your brain and your spinal cord. CSF in EDS patients can sometimes be blocked off or leak due to something like a Chiari malformation, or it can increase or decrease too much in pressure. TC and OTC. TC stands for tethered spinal cord and OTC stands for occult tethered spinal cord. Tethered spinal cord can be seen on an MRI and is often seen together with spina bifida or spina bifida occulta, whereas occult tethered cord cannot be seen on an MRI. This is pretty common in the EDS population. In cases like this, your neurosurgeon will have to make the diagnosis based on your symptoms and other testing. In both of these, the spinal cord is stuck or tethered to the inside of the spinal column where it shouldn't be. This can cause a lot of neurological problems and can sometimes be the cause of the Chiari malformation or scoliosis. In the end, both tethered cord and occult tethered cord pretty much cause the same symptoms and should be given the same treatment. POTS. POTS is a form of dysautonomia that causes a significant rise in heart rate when upright. If you want to learn more about POTS, I have a whole other video dedicated to it. I'll link that below. CCI and AAI. CCI stands for craniocervical instability, and AAI stands for atlantoaxial instability. Craniocervical instability is when there's too much motion or instability between the skull and the first cervical vertebra, your C1 vertebra. And atlantoaxial instability is when there is too much movement and instability between the first and second cervical vertebra, your C1 and your C2. Physical therapy is recommended, but in the EDS population, it usually requires bracing and surgery. And last but not least, CRPS. CRPS stands for chronic regional pain syndrome. CRPS is a potentially debilitating pain condition. It usually affects one of your limbs and can cause extreme pain, changes in skin color, changes in temperature, and swelling of the affected area. We think that CRPS is so commonly seen in EDS patients because it's usually brought on by injuries or trauma to the area. And as you know, we are much more prone to injury. And I think that's it. I probably forgot a ton, so maybe there'll be a part 2 in the future. If I missed any, please be sure to tell me down in the comments, and I can add that to a list for a future video, or I can answer your questions directly there. And I'll see you next time. Ow.